Of the proximal part of the humerus. In fracture of the proximal part of the humerus, consideration is given to the vascularity of the humeral head. The most common classification of the proximal humerus is near classification, in which we look at the 4 individual pieces of articular head fragment, which mostly denotes to the anatomical neck, lesser tuberosity, greater tuberosity and shaft. Here articular head fragment, most commonly anatomical neck, greater tuberosity, lesser tuberosity and shaft. In the shaft mostly fracture occurs at this side, so it is also called the surgical neck. Now there is a definition of fragment part. Part is defined as if a fragment is displaced more than 1 centimeter or it is angulated by more than 45 degrees centigrade in respect to the another fragment, then that displaced fragment is called part. So based on the fracture pattern, it may be undisplaced, 2 part, 3 part or 4 part. इसकी इम्पोर्टेंस क्या पार्ट की कि इफ़ there are more number of parts, then there are increased chances of the interruption of the vascularity of the humeral head and more complex injury. Mechanism: the fracture on the proximal part of the humerus occurs through the fall on the side or direct blow to the side or fall on the outstretched hand. Management: in undisplaced or minimally displaced fractures, conservative measurements are performed and a broad arm sling is applied. And in displaced fracture, treatment is different for young patient and old patients. In young patient, open reduction and internal fixation is done. Internal fixation is done with the percutaneous fixation, intramedullary nails and plate fixation. And in older patients who in where the head is avascular and who are osteoporotic and there are comorbidities present, then replacement of the humeral head by prosthetic material, hemiarthroplasty is done, but its limitation is that of the tuberosity healing. So increasingly primary reverse polarity shoulder prostheses are being used. This implant does not rely on tuberosity healing as it functions under the power of deltoid muscle.